What's your name and who are you with?
Frank Harvey, CEO of SureScripts.
How long have you been here?
About 3.5 years at SureScripts as CEO.
And what does SureScripts do for the people that don't know?
Yeah, think of SureScripts as the information superhighway for clinical data exchange. Really the largest interoperability company in healthcare, moving clinical data between health sites, between physicians and pharmacy and physicians, just really helping that clinical data movement that informs care.
Right now, there's an explosion of data centers with AI and information, and being at the forefront of those exchanges or interoperability between pharmacy is a strong component of the future of care. Where do you see SureScripts in the next 5 to 10 years playing within this area?
Well, if you think about it, there's always been all of this data out there, right? In abundance. The problem was trying to get that in a form where the caregivers or the physicians, providers can actually get that to make the right clinical decisions. So SureScripts, since our beginning 25 years ago, has been one of the leading interoperability companies. And now with our commitment as a CMS affiliated network with the federal government, as a QHIN, as part of TEFCA, again, for us, making sure the right data is in the hands of the right provider at the right time to make those right clinical decisions. So SureScripts is really at the forefront of interoperability in healthcare.
SureScripts has transformed how prescriptions move from doctor to pharmacy, but no one really knows what happens once the pill bottle reaches the home. How do we finally close the last mile of adherence?
Well, I would say it even goes back further than that. You know, almost 30% of scripts that are written that go to the pharmacy never get picked up by the patient. So it's a bigger issue. So we've got a product called First Fill Abandonment where we know what was written but never picked up. That's the first piece. Then it's once it gets to the home, if the patient actually picks it up, are they taking it appropriately? So there you need the care management teams at health plans to be able to make those right outreaches to patients to make sure they're taking the medications. And with that, you know, things like medication history for populations where health plans can, through SureScripts, access that data, understand when a patient may not be taking it appropriately, do the outreach to the patients to really help educate the patients on the severity of what's going to happen to their health if they don't take their medications appropriately. So I think it's a team approach working across healthcare to help patients do the right thing.
The $300,000 question: in dementia and heart failure, payers can spend hundreds of thousands per patient, often driven by missed meds. If we connected SureScripts data with real-world adherence, could this shift billions in savings across the system?
You know, that's an interesting question. There was an article in Forbes about 5 years ago, actually on Epic at the time, but they had a paragraph on SureScripts, and they estimated that SureScripts had saved healthcare $142 billion overall since its founding. And now you're looking at an even bigger opportunity to save. It's the medication adherence piece where, for a lot of reasons, as you said, can cost hundreds of thousands of dollars when patients go back to the hospital because they weren't taking their medication appropriately. So I think working with health plans closely, working with providers closely, SureScripts, the information that we have in our network can really help alleviate that. You're never going to stop it. You're always going to have those patients that, for whatever reason, are just not going to be compliant. But as much as possible, as many times as you can get in front of that, the better.
PBMs and payers already trust SureScripts, but what if you could show the 20% or more improvement in adherence guaranteed? Would that change how you define value in your network?
Well, it absolutely would. And one of the important things about SureScripts is something we call the SureScripts Network Alliance, which is our alliance with all of the PBMs, all of the health plans, all of the health systems. We connect 99% of the U.S. population actually transacts across the SureScripts network. Every prescribing physician, every pharmacy, every health system, we're ubiquitous across healthcare. So we're already, through those partnerships, building these bridges to help with those things. So that's what's really important. No one part of healthcare can do it on their own. It really takes a village, if you will, and the village is all of our partners in the SureScripts Network Alliance that can make those things happen.
So Frank, a lot of folks at the show have been talking about agentic AI. What capabilities pharmacy could have by pulling the right data, putting in the power of payers, providers, but most importantly, patients. If we can level a foundation by implementing a pharmacy-built agent to unlock the experience for the patient, how do you see that impacting SureScripts?
I think that would impact healthcare in a big way. As a matter of fact, we have used AI since the beginning of SureScripts, machine learning, the old AI, if you will. But lately with agentic AI in our products like our touchless prior authorization, which while the physician is prescribing the medication in the workflow, it goes out, our information goes out, pulls back the answers to solve those prior authorizations so they're cleared right in workflow. Never shows up in the pharmacy as being a prior authorization, never delays the patient getting on medication. So I think agentic agents have a big role to play across multiple parts of healthcare. Helping solve prior authorizations is one of those, helping provide the pharmacists who are becoming more and more clinicians, not just filling the scripts, but actually helping the patients work through their disease states in a lot of ways. And if you look 3, 4, 5 years in the future, the pharmacists will be spending much more of their time doing those clinical practice things rather than filling scripts. And so I think agentic agents are going to be an important part of that. They're going to help empower pharmacists to play the larger role, to work at the top of their license, if you will.